Welcome to our deep dive on chronic kidney disease and diabetes. You know, we always try to stay up on the latest guidelines, and you gave us the 2025 Standards of Care from the American Diabetes Association.
Hot off the press.
Yeah, hot off the press. So we're going to try to break down what you really need to know about these.
Absolutely. We're going to distill all the important recommendations and highlight the key takeaways for how we manage CKD in diabetic patients, and especially look at the impact of all these newer medications.
Okay.
Think of it as like your cheat sheet
Yeah, cheat sheet.
to stay ahead of the curve.
Okay, I like that.
Yeah.
We know you like to get to the point, but you also appreciate thorough explanations.
Yes.
So we'll deliver both. We'll give you the key facts and those little details that make you go, I never thought about it that way.
Exactly.
Okay, so why don't we start with the basics? Why are CKD and diabetes so often talked about together?
Well, CKD is a very frequent complication of diabetes,
Okay.
affecting a surprising 20 to 40% of patients.
Wow, that's...
And even more concerning,
Yeah.
it can actually lead to kidney failure requiring either dialysis or a transplant.
That's a scary thought for a lot of people living with diabetes.
Yeah, that really underscores the seriousness of CKD.
Yeah.
And the impact isn't limited to just the kidneys.
Right.
It also significantly increases cardiovascular risk and healthcare costs.
Wow, so it's like a domino effect.
A domino effect with very serious consequences.
So early detection sounds really important.
It is absolutely critical.
Okay.
The guidelines really emphasize the importance of catching CKD early through regular screening.
Yeah.
And there are two key tests they recommend.
Okay.
Checking for what's called albuminuria,
Yeah.
which is a measure of protein in your urine,
Mm-hmm.
and then also your estimated glomerular filtration rate, eGFR.
eGFR.
To put it simply, if you think of your kidneys like a filter, the eGFR tells us how well that filter is working.
Oh, that's a great analogy.
Yeah.
So let's say someone is diagnosed with CKD. What happens next?
Well, the frequency of monitoring really depends on the stage of their kidney disease.
Okay.
It could be as infrequent as once a year for early stages, but increase to every 1 to 3 months for more advanced cases.
Got it.
Managing CKD well involves a two-pronged approach, keeping both glucose levels and blood pressure under control.
Okay.
This combo is really critical to slow disease progression and reduce that cardiovascular risk we talked about.
Speaking of controlling blood pressure,
Yeah.
ACE inhibitors and ARBs keep coming up in these guidelines.
They're the stars of the show.
Okay, what's their role?
Well, they're the go-to medications for managing hypertension, particularly in diabetic patients with CKD,
Okay.
especially those with albuminuria.
Mm-hmm.
They're highly effective as a first-line therapy.
That makes sense. It's interesting that the guidelines even address serum creatinine levels, which, as you explained, is another marker of kidney function.
Yeah.
They actually say that if creatinine levels rise slightly, less than 30%, after starting these meds, you shouldn't stop taking them, unless there are other warning signs like volume depletion.
Exactly.
Okay.
So it highlights that we shouldn't overreact to a single lab value, but look at the bigger picture clinically.
Yeah, okay.
Now, I know you're interested in learning more about these newer medications for CKD.
Yeah.
There's a lot of buzz around these.
Yeah, there is.
Yeah.
SGLT2 inhibitors
All right.
and GLP-1 receptor agonists.
They're all the rage
They are.
in diabetes management.
Tell me more.
They're making some significant strides, and for a good reason.
Okay.
These medications are not only fantastic for controlling glucose, but they also have direct positive effects on the kidneys themselves.
Multitasking.
Multitasking medications, exactly.
It sounds almost too good to be true.
I know, right?
Is there any research that backs up how effective they are?
Absolutely. It's not just hype.
Oh.
Several large clinical trials have actually demonstrated that they can slow CKD progression and reduce cardiovascular events in patients with diabetes.
That's remarkable.
Their impact is pretty remarkable.
Yeah. So how do doctors decide when to incorporate these medications into a treatment plan?
Well, the guidelines actually provide specific guidance based on your eGFR levels.
Okay.
The fact that SGLT2 inhibitors are now recommended for patients with eGFR levels as low as 20 ml/min 1.73 meter per day is a real game changer.
So even in more advanced stages of kidney disease?
Even in more advanced stages,
Wow.
this means we can potentially delay dialysis for many patients and really improve their quality of life.
That's huge.
This is a huge shift in how we manage CKD.
So we have another potential player in the CKD arena, MRAs.
Yeah.
What can you tell us about those?
MRAs, or mineralocorticoid receptor antagonists, are definitely generating a lot of buzz, particularly Finerny.
Okay.
Recent trials are showing its remarkable potential in slowing CKD progression and also reducing cardiovascular events.
So another tool for managing CKD?
Another great tool.
What's the catch?
Well, MRAs are still relatively new.
Okay.
While promising, the guidelines recommend being cautious and carefully monitoring potassium levels
Okay.
when prescribing them.
Makes sense. Better be safe than sorry.
Exactly. Exactly.
Okay, so what about the role of nutrition in managing CKD?
Oh, nutrition is a critical piece of the puzzle.
Mm-hmm.
For patients with CKD stages 3 to 5 who don't require dialysis, the guidelines recommend a protein intake of 0.8 grams per kilogram of body weight each day,
Oh.
which is similar to the general population's recommended daily allowance.
So it's not about restricting protein entirely,
Right.
but keeping it at a moderate level.
Yeah, higher protein intake has actually been linked to a faster decline in kidney function.
Oh, wow.
So dietary management is really essential to help slow that decline.
So this is a lot to digest already.
I know, right?
At what point should someone consider seeing a nephrologist?
Well, the guidelines outline a few scenarios where it's really crucial to seek expert advice.
Okay.
If there's uncertainty surrounding the cause of CKD,
Mm-hmm.
if managing the condition becomes particularly challenging,
Right.
or if CKD has progressed to an advanced stage, meaning an eGFR below 30 mmol 1.73 metal-to-co, then you really need the expert help.
So it's not just the stage of CKD, but the complexity of the situation.
Exactly.
Yeah.
Sometimes you need that additional layer of expertise to really navigate all the intricacies of CKD.
That makes a lot of sense.
Yeah.
So I think we covered a lot of ground in this first part of our deep dive.
Yeah, we did.
What are some of the biggest takeaways you'd want our listener to remember about these 2025 standards of care for CKD and diabetes?
Well, early detection is absolutely paramount.
Mm-hmm.
If we can identify CKD early,
Yeah.
we have a much better chance at slowing its progression and preventing those serious complications we discussed.
More time to intervene.
More time to intervene and potentially change the course of the disease.
Exactly.
It's also crucial to optimize management by controlling both glucose levels and blood pressure.
Yeah.
Those are the cornerstones
That foundation.
of effective CKD management.
Yeah. A strong foundation.
Yeah, building a strong foundation for long-term health.
Exactly.
And we can't forget about those new medications.
Right.
SGLT2 inhibitors, GLP-1 receptor agonists, and MRAs are truly shaking things up,
They are.
offering us new and powerful tools to actually protect kidney function, not just manage diabetes.
It's a new era.
It's a new era for CKD management, absolutely. Yeah, it's a really exciting time to be in CKD research, for sure.
It sounds like we're moving toward a more proactive and comprehensive approach to CKD management.
Yeah.
It's not just treating symptoms.
Absolutely.
Right.
The focus is shifting towards preventing or delaying the progression of kidney disease.
Yeah.
And really trying to improve long-term outcomes for patients.
That's the goal.
That's the ultimate goal.
And these 2025 standards of care are providing healthcare professionals with the latest knowledge and tools they need to deliver that kind of care.
Yes. They serve as a roadmap to better outcomes for
Absolutely.
individuals living with both diabetes and CKD.
It's good to have a roadmap.
It is. And these guidelines are constantly evolving with new research,
Right.
which is why it's so important for everyone to stay informed and engaged with their health.
Knowledge is power, especially when it comes to our health.
Absolutely.
I know we've only just scratched the surface of these guidelines. What else do we need to dive into?
Well, let's shift gears a little bit and talk about pregnancy, which is obviously a very crucial time for women with diabetes.
Okay.
And when you add CKD into the picture, it becomes even more critical to manage things carefully.
So how do these guidelines address managing CKD in pregnant women with diabetes?
Well, they stress the importance of meticulous planning and management.
Okay.
So for women with diabetes who are considering pregnancy or are already pregnant, they recommend a thorough assessment of kidney function,
Okay.
which includes checking both albuminuria and eGFR.
So getting a baseline and identifying any potential risks.
Exactly, early on in the pregnancy.
Okay. What else should these women be aware of?
The guidelines also highlight certain antihypertensive medications that could be harmful during pregnancy.
Okay.
So if possible, women should switch to safer alternatives before becoming pregnant.
To protect both the mother and the baby.
Absolutely. The health of both the mother and baby is paramount.
What about managing existing CKD during pregnancy?
One of the key recommendations is actually aiming to reduce urinary albumin by at least 30%.
Okay.
In patients with CKD who have high levels of albuminuria, specifically above 300 milligrams per gram,
Okay.
this reduction has been linked to slowing down the progression of CKD.
So another way to hit the brakes on the advancement of the disease.
Exactly.
Now, while we've been talking a lot about medications,
Mhm.
it's important to remember the role of lifestyle modifications in managing both diabetes and CKD.
Oh, absolutely. Those lifestyle changes are so powerful.
Diet, exercise, weight management, all the things we hear.
All those things.
They're essential for everyone, but especially people managing a chronic illness.
It can help improve blood sugar control, lower blood pressure, and even slow down the decline in kidney function.
So it's really a holistic approach.
It is.
It empowers patients to take control of their health.
Exactly.
Rather than just relying on meds.
Absolutely.
We talked earlier about when to see a nephrologist.
Right.
Is there any situation where their expertise is especially important?
Yes. The guidelines actually provide some key indicators for when it's really crucial to involve a nephrologist.
Okay.
If there's uncertainty about what's causing the kidney disease, if managing the condition becomes challenging,
Okay.
or if CKD has progressed to an advanced stage with an eGFR below 30 lmin, 1.73 mL2, you really need to bring in the expert.
So they can offer that specialized expertise and guidance when things get a little complicated.
They're like the CKD detectives.
Oh, I love that.
Yeah.
So the guidelines, do they mention anything about early referrals to a nephrologist?
They do.
Is there a benefit to seeing a specialist sooner rather than later?
Yes. Studies have actually shown that early involvement of a nephrologist can lead to better outcomes for patients,
Okay.
including delaying the need for dialysis.
So being proactive.
Always better to be proactive and seek expert help when needed.
Makes sense. It's about taking a proactive approach to managing your health.
Absolutely.
And getting the support you need.
Exactly.
So speaking of needing support, let's talk about acute kidney injury, or AKI.
Yeah.
I've heard the term, but I don't fully understand what it means.
So think of AKI as a sudden episode of kidney damage.
Yeah.
It can happen for a variety of reasons, like infections, certain medications, or even dehydration.
And how does that relate to CKD?
Well, because people with diabetes are already at a higher risk for developing CKD.
Right.
If they then experience an episode of AKI, it can really accelerate the decline in kidney function.
Oh, like adding fuel to the fire?
It's like pouring gasoline on a
Right.
fire.
That sounds like a serious concern.
It is. But the good news is the guidelines offer some guidance on how to identify and manage AKI early to minimize its long-term impact on kidney health.
So being vigilant and recognizing the signs.
Being vigilant and getting prompt medical attention if something seems wrong.
What are some signs that someone might be experiencing AKI?
One sign is a sudden decrease in urine output. Swelling in the legs, ankles, or feet can also be a red flag. Other symptoms include fatigue, shortness of breath, nausea, and confusion.
So it's really important to listen to your body.
Absolutely.
And seek medical attention if you experience any of those symptoms.
Yes, and it's also important to be aware that a slight increase in serum creatinine after starting ACE inhibitors, or ARBs, shouldn't automatically be mistaken for AKI.
Why is that distinction important?
Because these medications can sometimes cause a small, usually temporary, increase in creatinine levels,
Okay.
typically less than 30%. So it's not a sign of kidney damage,
Okay.
but rather a reflection of how these medications work.
So not necessarily a reason to stop taking the medication.
Exactly. In fact, the guidelines specifically advise against discontinuing ACE inhibitors, or ARBs, due to small creatinine increases, unless there are other concerning signs, like symptoms of volume depletion.
So don't jump to conclusions based on a single lab value.
Exactly.
Always consider the context.
Right.
And consult with your healthcare provider.
Precisely. Medicine is all about nuance and individualizing care.
Right.
Now, let's shift gears a little bit again and talk about monitoring for complications.
Okay, what are some common complications that can arise from CKD?
Well, there's a wide range.
Yeah.
But some of the most frequent include electrolyte imbalances, like high potassium levels,
Okay.
anemia, which is a shortage of red blood cells, metabolic acidosis, where the blood becomes too acidic,
Okay.
and even bone disease.
Wow, that's a lot.
It is. But the guidelines provide clear recommendations on which complications to monitor, how often to check, and potential interventions if needed.
So it's like a roadmap for managing those complications and staying ahead of them.
You got it.
So regular checkups and open communication with your healthcare team.
It's essential.
Really essential.
They are your partners in managing CKD and preventing those complications.
It takes a village
It really does.
to manage CKD effectively.
It does.
It's definitely a collaborative effort between patients and their healthcare providers to achieve the best possible outcome.
Yes.
You mentioned earlier the importance of understanding the underlying cause of CKD
Right.
in individuals with diabetes.
Yes.
Why is that so crucial?
Well, pinpointing the root cause can really help guide treatment decisions
Okay.
and help us determine the best course of action.
So, for example, if the CKD is primarily driven by diabetic nephropathy,
Right.
which is damage to the kidneys caused by high blood sugar,
Mm-hmm.
then optimizing glucose control becomes even more important.
Even more important.
But what if something else is contributing to CKD besides diabetes?
That's when things get really interesting.
Okay.
The guidelines actually outline several warning signs that suggest non-diabetic kidney disease might be a factor.
Okay, what are some of those warning signs?
One red flag is CKD developing in someone with type 1 diabetes for less than 5 years.
Guy?
The presence of blood or protein in the urine,
Hmm.
especially if it's increasing rapidly, is another one. Also, someone with type 1 diabetes who doesn't have retinopathy, which is damage to the blood vessels in the eyes, might have a different kidney issue going on.
So these are all clues that something other than diabetic nephropathy might be at play.
Exactly. And if any of these red flags pop up, the guidelines recommend a prompt referral to a nephrologist for further investigation.
So it's like playing detective and gathering clues
Yeah.
to understand the root cause of the CKD.
That's a great way to put it.
Now let's discuss a specific type of kidney disease that can sometimes mimic diabetic nephropathy,
Right.
non-diabetic renal diseases, or NDRDs.
NDRDs.
What are those and why should we be concerned about them?
So NDRDs are basically kidney diseases that aren't caused by diabetes.
Okay.
They can be caused by a variety of things like autoimmune disorders, infections, or even certain medications.
So how can you tell the difference between NDRDs and diabetic nephropathy?
Right. Well, that's a good question.
Why is it important to distinguish between the two?
Because the treatment approaches can be very different. If an NDRD is mistakenly diagnosed as diabetic nephropathy, it might not respond to standard diabetes management strategies,
Okay.
and the underlying condition could actually worsen.
So it's really important to get that diagnosis right.
Absolutely. We need to make sure we're treating the right
To
problem.
make sure you're treating the right problem.
Exactly. And the guidelines actually offer some valuable insights into the clinical features that can help distinguish NDRDs from diabetic nephropathy.
Okay.
Those red flags we talked about earlier, like a short duration of diabetes before developing CKD, are important clues.
So we're really peeling back the layers here of
Yeah.
CKD and understanding all the complex inner workings of the kidneys.
It's a fascinating field, and it's constantly evolving as we learn more about how to protect and preserve kidney health.
Wow, I have to admit, diving into the world of nephrology has been fascinating.
It is.
There is so much more to kidney health than I ever realized.
It is a very complex and intriguing field.
Yeah.
We're really only just beginning to scratch the surface of understanding how the kidneys work
Right.
and how they are impacted by other systems in the body.
Speaking of connections within the body,
Yeah.
I'm curious about something you mentioned earlier, the gut microbiome.
Yes.
What is that?
Oh.
And how does it relate to kidney health?
So that's an area of research that's really exploded in recent years.
Okay.
The gut microbiome refers to the trillions of bacteria that live in our intestines.
Right.
And for a long time, we didn't fully understand their role, but we now know they play a really significant role in our overall health,
Okay.
including the health of our kidneys.
So how does the gut microbiome impact CKD?
Well, emerging research suggests that an imbalance in the gut microbiome, what's called dysbiosis,
Dysbiosis?
can actually contribute to inflammation and oxidative stress
Okay.
throughout the body and ultimately damage the kidneys.
It's like a chain reaction.
Yeah,
Gut dysbiosis leads to inflammation and oxidative stress,
exactly.
and then that negatively impacts the kidneys.
That's a great way to visualize it. And this research has really sparked interest in finding ways to manipulate the gut microbiome
Okay.
to improve kidney health.
So things like probiotics or
Probiotic
dietary changes.
dietary changes.
Could those help restore balance?
Those are two really promising areas that researchers are exploring.
Okay.
It's still early.
Yeah.
More research is definitely needed to fully understand that complex relationship between the gut microbiome and CKD,
Right.
but it is a very exciting area of study.
It really highlights how interconnected our bodies are
Yeah.
and how seemingly unrelated systems can influence each other.
Absolutely.
Okay, so now I can't let you go without asking about another hot topic in healthcare these days.
Sure.
Artificial intelligence,
Oh, yeah. Right.
AI.
AI is everywhere.
How is AI being used in CKD management?
Well, AI is rapidly transforming healthcare,
Mm-hmm.
and CKD management is no exception.
Okay.
The possibilities are really quite incredible.
So what are some of the ways AI is being used to manage CKD?
Well, AI algorithms can analyze vast amounts of data,
Yeah.
from sources like electronic medical records and imaging studies to identify patients at risk of developing CKD,
Okay.
or those who might be experiencing disease progression.
So it's like a high-tech early warning system?
That's a great way to put it.
Okay.
And AI can actually do even more than that.
Okay.
It can also help personalize treatment plans by analyzing data to predict which interventions are most likely to be effective for each individual patient.
So it's like having a virtual CKD coach.
Exactly.
That's amazing.
It's really incredible how AI is changing the way we approach healthcare.
Yeah.
And we're really just starting to tap into its potential for managing CKD.
It seems like it has the power to revolutionize how we prevent, diagnose, and treat CKD.
It really does.
It's exciting to imagine what the future holds.
It is. And the 2025 standards of care actually recognize the transformative potential of AI.
Okay.
They encourage healthcare professionals to stay informed about advancements in AI
Yeah.
and how it can be applied to CKD management.
It sounds like nephrology is constantly evolving,
It is.
and we need to embrace these advancements to provide the best possible care for our patients.
Exactly. Speaking of providing the best possible care,
Mm-hmm.
these guidelines also highlight another really crucial aspect of CKD management: shared decision-making.
Moving away from that paternalistic model of care
Exactly.
and empowering patients
Yeah.
to be active participants in their health.
Absolutely. The 2025 standards of care emphasize open and honest conversations
Mm-hmm.
between healthcare providers and patients
Okay.
to ensure that treatment decisions align with the patient's values, preferences, and goals.
So respecting patients' autonomy
Exactly.
and understanding that there's no one-size-fits-all approach
There
to
isn't.
CKD management.
No.
Yeah.
The best treatment plan really considers the individual's unique needs and circumstances.
It's about personalized care.
It's the heart of patient-centered care.
Okay, well, I think we've covered a lot of ground in this deep dive
We have.
into the 2025 standards of care for CKD and diabetes.
Yes.
I hope we've provided you with some valuable insights.
I think so.
I feel like we only just scratched the surface.
Yeah, we did.
But it's been incredibly informative.
It has.
We've discussed early detection, risk assessment, cutting-edge treatments,
Absolutely.
and even the transformative potential of AI.
Yes. And we've underscored the importance of personalized care,
Yeah,
shared decision-making, and patient empowerment.
it really takes all of that.
It does.
So remember, everyone, knowledge is power.
Absolutely.
Stay curious, stay informed, and advocate for your health.
Couldn't have said it better myself.
We hope you found this deep dive into the 2025 standards of care helpful and empowering.
We do.
Until next time, stay healthy, keep learning, and keep diving deep.